Good morning, fellas. How are y'all doing?
Good morning.
Good morning. Doing good, Jamie. Thanks for having me on this morning with my good friend, the best dressed doctor in medicine, Dr. Alex Rasouli. When people ask me about Dr. Rasouli, and they say, what's his name? I say, it rhymes with Fazuli, even though it's spelled different. Do a lot of people say that, Dr. Rasouli?
True. They do. We get that a lot.
Got it.
That's fine. I can think of worse comparisons, but that's good.
Hey, we're here starting off our big interview today with Dan Nitro Clark and Dr. Rasouli, as you mentioned, for the ADR support and Facebook group. If you're watching us on YouTube, please find us on Facebook. This is where you can see all the great information. A little bit about Dan Nitro Clark. He's a TV host, life coach, speaker, former American glider, and I got his book, best-selling author of F Dying and also The Gladiator. Dan, how's your back feeling?
My back feels great post-surgery. I'm just so thankful, and that's why I came on today. I'm so thankful for Dr. Rasouli. I went and saw 4 different surgeons, Alex being one. See, we're really close now. I call him Alex. Dr. Rasouli was one of them, and the first surgeon I saw was the head of a big university downtown, USC. And he said to me that I would need to get a 3 to 4 level fusion. But he said, any type of athletics you want to do, your CrossFit, all that kind of stuff, tennis, he said, forget about it, it's going to be over. I went and saw the head of UCLA, and he was a neurosurgeon, a great guy, but he was like, you're in too good a shape to be in that much pain. And I was like, no, you don't understand. There's the many, many days I can't even move and I can't get up. And a lot of it was, most of it was, it started off a long time ago with degenerative disc disease, football, this and that. But then I was in a car accident about 2.5 years ago, and that just, boom, put me over the edge. Things that I was able to do with conservative therapies no longer worked, and I was in some of the most excruciating pain in my life. I went and saw a 4th guy down at Hogue, who was a great guy. He was very good. He just didn't do advanced disc replacement for the lower back. And he was going to do said, let's do a 2 level. I can get you back working out. Then he looked back. He said, we probably should do a 3 level. Then when I went and saw Dr. Rasouli, he came in there in his suit, and he's not a real emotive guy. He just kind of looks, there. And I go, is this guy a model or is he a doctor? So he comes in and he's kind of soft spoken. And I was like, okay, listening. And he just looked at my stuff and he did a very thorough examination of my MRI and said, hey, here's what I want to do. I want to do a fusion on the bottom, and I want to do 2 levels of ADR above. And he said, you will be able to get back 100% of your athletic ability. I'll be able to fix the pain. You'll be able to go, be bigger, stronger, and faster and going. And for me, it was like, what? No one else is telling me that. So that took me down this long path towards finding and researching what ADR is, advanced disc replacement, and finding you guys, because 6 months before that, I'd never even heard of it. It wasn't even a consideration. And I think that's a shame that so many people in America are going into fusions where the recovery time, where there's success results, where there's adjacent disc disease, where there's things where they're not going to get the great results they want because they just haven't heard of it, and there's not enough doctors like Rasouli who are doing this.
Dan, what all conservative treatment did you try? Because that's one thing that I love about Dr. Rasouli is he makes you go through every possible solution. And then how did you know when was when? And I know your accident was obviously probably a big factor because the back pain just probably never went away. But what did you all try? I know we talked about when we first met.
It was worse than the back pain that wouldn't go away. I mean, literally after the car accident, I was in the emergency room 3 to 4 times just because the pain was so severe. It was this, I say nerve pain because it was just, I felt like I was being prodded with a cattle prod in my lower back. I mean, like I would just shake and I couldn't move and I couldn't breathe. I've never felt pain like that. And I've had knee surgery. I've smashed fingers and playing in the NFL, American Gladiators, and I've gotten jacked up, been knocked out. I've never had pain like that. And that all started after the car accident. So to me, and it also got to the point where I had to start canceling trips. my girlfriend and her son were going to Portland for a couple of days, and I had to cancel. I was too afraid to get on the plane. I was in too much pain. So it was very apparent to me that I had to do something, and he felt like the best option. So the conservative care was I probably had 30 to 40 epidurals. Wow. So when I say 30 to, maybe it's even more, because we would do 3 to 4 levels at one time. So 1, 2, 3, we'd do the L5, S1. So I did 30 to 40 of those. I would say maybe 6 or 7 times. I did cryotherapy. I did acupuncture. I did yoga. I did massage. I actually even went and had the nerves burnt. What's that called, Dr. Rasuli, where they burn the nerves?
It's called radio frequency ablation, also called rhizotomy.
So I had that felt great in the test for it. So I went and had the test done where they burned the nerves. And when I walked out of there, I was like, I feel great. Next day, the pain was back. So it didn't last. So I tried, for me, everything, because I did not want to have back surgery. My father had a 3-level back surgery, a fusion, and he was stuck in our living room for 6 months, unable to move in a hospital bed. And that was my greatest fear.
Dr. Rasuli, when Dan came in, what were your thoughts on his spine? I mean,
sexy beast. He was like, he's a sexy beast.
Yeah,
his reputation is going down the drain.
I thought about his sexiness. When you have a patient like Dan that is obviously fit, obviously athletic, and obviously limited due to recent events or whatever reason from doing what he likes and what defines him, your treatment strategy has to be necessarily to preserve as much of his function as possible, or restore as much of his function as possible. For sure, you don't want to do something that limits his function forever. You're better off doing nothing for him than doing something like that.
And he was so confident, though, man. I have to tell you, man, I walked in there and he's like, I can get you healthy. I can get you back. You're going to be 100%. And I was just like, what? Because that's not what I was hearing from, 3 other top doctors in California, top back surgeons, at research universities. And, he was just so confident that he could do it. And I was like, really? I didn't believe him. I did not believe him, but I'm glad that, I believed him enough to go with him and do the ADR, because recovery was tough. Now, if you're someone who's thinking about ADR and you're doing a 3-level, and maybe Dr. Rasuli can speak to this, because I had the fusion on the L5S1 and the ADR above, does that fusion component make the recovery more difficult than if it was just someone who only had ADR?
It does. So with fusion, the act of surgery is not the fusion. The act of surgery is putting in the scaffolding and the sort of the foundation upon which the patient's body then grows bone. And once that bone has grown and sort of melded the 2 bones together, that's the fusion. And that takes time. So it's not a sort of a set it and forget it step in surgery like the artificial disc. The artificial disc, you put it in, you're done. The patient's good to go the next hour. With fusion, you have to wait 6 weeks, 8 weeks, sometimes 3 months, sometimes more than that, for that bone to meld. So that's why fusion has a little bit more of a prolonged recovery curve than a disc replacement. And combine a fusion with a disc replacement, well, you got to wait for that fusion to take before you can enjoy the benefits of the disc replacement.
Right. So it's only 6. I thought when we were going through, you said sometimes it takes 6 months to a year for the fusion once you put that bone dust on there to completely fuse.
Yeah. Most people, sort of, if you go with the bell curve, the standard deviation and all that, 95% fuse by 3 months using modern techniques. There's some outliers on either side of that curve that can take 6 months to a year to fuse. If you're not fused, in my experience, by 9-10 months, you're probably not going to fuse without some additional surgery. And that's the other thing about fusion, is a lot of people, probably less fit than you, Dan, don't fuse and then have to have additional surgery to get them to fuse. So that's the other issue.
Right. And then can you remind me why we decided to fuse the L5S1? I remember I went in, you said you don't get much joint mobility over there on the L5S1, but I see that some other doctors, they go and they put a artificial disc in L5 and S1. But for me,
Yes.
we decided not to. Do you remember why?
Right. And we often do disc replacement at L5, S1. The limitation with L5, S1, and in fact, any other disc, particularly in the lumbar spine, any other level, is if the degeneration of the disc is long-standing enough, the joints behind the disc that we call the facet joints, that's the two prongs that actually hold two bones together, they become so disfigured as to make a disc replacement not a good idea. If you restore motion against a really run-down facet joint, you cause more pain than before. So that's the primary reason that L5, S1, and U had to be fused, because it was just too far gone. But there are other reasons why L5, S1 in some patients can't be replaced. They have to be fused. That's if the slope or the particular attitude or the inclination of the L5, S1 is so steep as to render a disc replacement either not a good idea at best, or probably a bad idea at worst. And then bone quality at L5, S1 also has to be taken into account.
Right. So, but the good thing about doing the disc replacement above that, if I remember correctly, is you said I don't have to worry about adjacent disc syndrome. Can you explain that to me again, like what adjacent disc syndrome is?
Yeah. So the spine is not one or two discs. It's several discs stacked on top of each other, and they distribute load amongst themselves. They're a community of discs, and each disc sort of pitches in to constitute overall motion. If you take one of these discs and you fuse it, meaning you take a bone and you take out the disc in between the bone and the bone underneath it, and you do a fusion, all the motion that disc was responsible for then gets redistributed amongst the remaining discs, particularly the disc above it or below it. So, and if you fuse enough levels, the levels that are left are doing so much more work than they were before that they get run down as well, very quickly, faster than they would naturally. And so that's called adjacent segment degeneration, meaning the running out or wearing out of discs above or below a fusion. The disc replacement spares the patient of that, because when you're done with the surgery, that level is still moving, motion is spared. And so the discs above and below are enjoying the same amount of responsibility, that they're perhaps even less responsible than they were before the disc replacement was done at the other level.
I mean, did you know I was going to turn out this awesome? Or did you know the back was going to turn out this awesome for me?
Your results are typical. Thank
Are
God.
they? I thought it was special. Jamie, I thought it was special, Jamie.
Your recovery was faster, given that you had a 2-level disc replacement over a fusion. Your recovery is faster given how motivated and athletic you are.
I got to say, it was not easy, man. I mean, I think, I didn't know what to expect, but I got better results, and it's weird, my brain is like, sometimes I wait for the other shoe to fall. Like, okay, this is just too good. This is too good. Something's going to happen. Something's going to happen. No, don't be negative. Don't think that way. You feel great. Well, no, shit's going to happen. No, I go back and forth in my brain, and it's like, you know what? It's good. But I'm not even superstitious, you guys, but I still knock on wood. Whenever I say my back is great, I knock on wood. You know what I mean? Just because it's like, wow, I never thought that 2 years, it's been a year and 4 months. I never thought a year and 6 months ago, 2 years ago, that I could possibly get these results and be doing what I'm doing and not to be living with daily back pain. I mean, I did not expect it to be this good. It exceeded my results. I figured I'd always be, still have the pain, but it just wouldn't be as bad. So it's been but the recovery was not easy. The recovery was not easy. And I think the one thing I wasn't prepared for was, and I think you explained it to me, Dr. Rasuli, one day I went in, you told me it was the stretching of the nerves by adding the vertebral space. Right? Because I was like this before. When you showed me my x-rays, there was like, you said you could barely put a needle between my vertebrae. It was so smashed down. Right. And by opening that space in 3 areas, it stretched the nerves?
Yeah. So when your disc wears out, there's nothing holding the bones apart from each other. So you get bone collapsing on bone, vertebrae collapsing on vertebrae, and nerves are passing in between those vertebrae, the nerves that go down your legs, into your back, wherever. And if in a matter of seconds you suddenly restore the distance between those bones, the nerves get stretched. And until they get used to their new sort of configuration, they're going to cause pain.
Yeah, that was unexpected. I remember like the first week or two into it, it was just so, I mean, I was getting those shocking pain, those prodding, shocking pains, and it wouldn't stop. And I remember I called you a few times and you're like, it's so funny because I see some people in the group, they're like, I'm having nerve pain, and they go to the group, which is great. But I said, the first person you should call is your doctor. Post on the nerve, but call your doctor. I said, call Rasuli and ask them. And I remember right away you're saying, hey, go back down, get another MRI. Let me take a look at it and let me see if there's anything, if the disc, you didn't use the word the disc is slipped, but go take an MRI, you said, let me just check. And I'd come in, you say, everything's fine. It's just a nerve. And I looked at it like this. If I stretched a nerve ligament in my ankle, like an eighth of an inch, I wouldn't be able to walk. You wouldn't be able to walk if you stretched that nerve an eighth of an inch. And I did that on 3 levels, but that took, for me, that took 6, 8 weeks, 12 weeks, and at the time I was suffering, I didn't think it would go away. And I was like, I really did it now. I really messed it up. I'm gonna have this pain the rest of my life. And like every other pain, it slowly went away. Where now, I don't feel it. Sometimes on the end of the range of motion. So if I'm in CrossFit and I'm holding on a bar and I'm kicking my feet up, where my feet are up, I'm hanging on a bar, and this is my lower half. I try to touch the ball. I feel just a little bit of like I lost a little bit of mobility, and I get just a teeny bit of pain, but over the last few months, it slowly goes away. Like doing a burpee, when I would be in plank position and jump my feet up to my hands, I'd feel like a little stab of nerve pain. And over time, that has slowly gone away. And I'm not as strong as I was before the surgery, but I just think I haven't been training as much because things have gotten into life. But I was on a friend's podcast the other day, and he was just saying, well, you're deadlifting 300 pounds for reps again. And I said, yeah, but that's not very strong. And he was like, wait a second, you understand what the normal person,
right,
100 pounds at over 50 years old, 4 repetitions is a hell of a lot of weight. And I was like, oh yeah, I guess that makes sense. And Dr. Rasuli gave me the clearance to go lift as much as I want, which still seems kind of weird to me. So you're telling me I can go back and eventually work up to, if I wanted to, 450, 500 pound a deadlift?
Whatever you can tolerate. It's the whole point. Otherwise, what's the point of doing this kind of surgery? It's to restore life, restore motion, restore life.
That's crazy to me. That's crazy. Jamie, you have some questions. I know that, man. What's going on?
Dr.
You let me talk all the time.
Dan, you went through just about every one of my questions, almost every one of my questions, but it's been fascinating, and you're talking from the heart, and that's the most important part for our viewers to really see, is you're talking from it, you're talking honest, you're talking candid, and it's so hard to find that information out there, and that's what the group is about. But I'm going to drop an atomic bomb on Dr. Rasuli. I'm going to go back to something you mentioned, Dan, is why when Dan went to all these top highly caliber surgeons, why are you the only one that's doing artificial disc replacement? Why aren't these other guys, you think, stepping across the line and being more, I don't want to say ethical, but why do you think they're going the directions they are, still saying, Dan, we're going to fuse you and you're not going to lift 300 pounds ever again?
Yeah, well, let me say this first, just to be fair to them. A couple of them did cervical, but they were not doing lumbar, just to set the playing
field.
Sure,
right. I think we understood that, yeah.
There are a couple of reasons, and I've been thinking about this myself. The first reason is that the dogma right now in spine surgery, in the discipline, the teaching and the custom is that spine surgery is not for quality of life. It's not a quality of life undertaking. It's sort of a reactionary discipline where a problem develops and you fix the problem only if it's life-threatening or nerve-threatening or limb-threatening. You don't offer spine surgery for quality of life restoration. And whereas the fact is that back pain, neck pain, nerve pain affects quality of life. And we have all this great technology. And I broke with the dogma. I don't think that spine surgery should be limited to people with only life-threatening or limb-threatening issues or on the verge of paralysis. I think it should be offered to people. If the surgery is good and if the surgeon is good, it should be offered to people who have a lot to give yet to life and want to be active. And so they should undergo procedures that will restore them to that state. That's the first reason, is that the dogma right now in spine surgery is a very outdated one. The second issue is when artificial disc replacement in the lumbar spine first came out, the technology was poor and the technology failed. And unfortunately, that left a bad taste in a lot of people's mouths, particularly the academic arenas, where a lot of the quote unquote top surgeons are thought to exist, but that's no longer necessarily true. But in academia, in university settings particularly, lumbar artificial disc replacement is not celebrated. It's viewed as a quality of life surgery, not a necessary surgery. Our opinion is that if it's affecting quality of life, it is a necessary surgery. Nowadays, lumbar disc replacements are much better technology. There are a host of R&D going toward disc replacements and making them better. And eventually, it's going to come to a head where if physicians don't know how to do these surgeries, they can't offer patients what they want.
Yeah, I mean, I think you definitely nailed it on the head. I mean, I kind of know that question too, and I think the other thing that we've talked about in previous interviews was the relation with pay that a spine surgeon, and you know this as well because you took a pay cut to start doing ADR. Most spine surgeons will get paid more for a fusion than they would an artificial disc replacement, and I think that's one thing that's the reason why I answered that question is because there's some people that live in areas where there isn't any artificial disc replacement. And that's why you're probably getting so many people from our group, and you're probably going to be the CrossFit masters surgeon go-to person from all this. I'm sure you're going to be seeing everyone. And I just know you did another CrossFit athlete this week, and she's doing fantastically well and came to the group. And I don't know if you know this, and bragged about you for about 3 paragraphs long. So accolades to you once again, and we've had a lot of patients come through our group and give you great accolades. So I think that's really important, and you give a lot of people hope out there.
Let me say how I didn't talk about how I first ran into Dr. Rasuli or heard about him. He came on my map. There was another girl gladiator from the new version named Robin, and when I was having back pain and talking about it online, she's the first one who put advanced disc replacement on the map for me. She said, you got to see my surgeon, Dr. Rasouli. I was like, okay, yeah. I just was like, right. And everyone has the best surgeon. Whenever you talk to somebody, everyone, try my guy. And I kind of blew her off. And then she hit me up again. She said, no, you got to go see him. He's doing this thing called advanced disc replacement. I was in a clinical trial with him, so now was it 14 years ago, Dr. Rasuli? 12 years ago?
A little less, probably about nine years ago.
Okay, but 9 or 10 years ago, she was in a clinical trial with him with a group of people, and she said, we're doing this new innovative thing called advanced disc replacement. And that's when my mind was blown. I started to go down the wormhole, found all you guys, and I think for a lot of people, when they first hear disc replacement, they've never heard of it. Because I talk to people all the time. They're like, what magic do you speak of? And for me, it was the same thing. But I'm a guy, when I hear something, I read, I start to study, I Google, I research, I look at the studies. And I found this one study online with young athletes and how there was I don't know the exact rate, it was like a 90% success rate who had ADR at young age. And I was like, wow, that's amazing. And what was important to me, what sold me, that this wasn't just some, new fly-by-night thing, was I asked Robin, I said, are you still in contact with people in your group? And are you the only one that had successful results, or is everybody still doing well? Because Robin had a 1 level, and she said she was one level lumbar, and she said she was riding her horse 6 to 8 weeks later. And that was completely contrary to what I was hearing on the fusion side. 6 months to a year, if it takes, you won't have mobility, all this stuff. So it was such a mind-blowing thing. I dug in and researched it. But Robin also said that she's in contact with other members in her group, a handful, and they're all still 8 years later doing well. That was the thing that really sold me, that put me down. And then going on the group and seeing other people who've had the same success stories. Now, some people opt to go overseas. For me, I wouldn't do it. Just for me, the idea of having someone, and I happen to live close to Los Angeles. So for Los Angeles, it made sense for me to go down the street, because I'm the kind of guy who I want my doctor down the street if shit goes wrong. Shit hits the fan, I want to be able to say, hey, dude, where are you? Meet me in the parking lot. But I want to be able to go down. I want to be able to see him. And, when that nerve pain was happening, it brought me such comfort and relief to know that, the doctor was down the street for me. I could go see him, which I did quite a few times in the first few months. Hey, am I okay? I'm okay. And he's like, yeah, you're doing fine. This is part of the process. So, I just wanted to put that information out there, how I first got to Rasouli, and I want to thank Robin for sending me those emails and opening my light to ADR and things that you can accomplish if it goes well.
For sure. I think the story, how we talked about it last night, how we kind of came across each other was CrossFit Masters, and I saw you complaining right after your accident, and I started sending you some PMs like, hey, you should join the group. And you got on the group, and next thing you were asking tons of questions. And I think it was about 6 months later. How long was it after the accident? And you kind of scheduled things with Dr. Rasuli?
Well, I never thought I was going to have surgery after the car accident. My assumption was the way I've healed my body, the kind of shape I was in. I got in the accident. It was, I think it was April 22nd, or right, beginning of April. I was at a CrossFit competition in Miami, with 15 of the best world CrossFitters in the world. And I was, swimming in the ocean. I was lifting tires. I was taking a 120-pound sandbag and running around a stadium. I was deadlifting. I was doing handstand push-ups. I was rowing. I was doing everything. A few months later, I said, I'm going to recover from this car accident. It's going to be a few months, and boom, it didn't happen. I kept going. But again, the last thing I wanted to do was surgery, because I had that memory of my father, and I didn't know about ADR at that time. So I think I saw Rasouli, maybe 3, 4, 6 months before the surgery. Maybe 3 months before the surgery, because again, I wasn't going to have surgery. I was going to get better. And then once all those conservative things stopped working or did not work, and I was in so much pain, I was crawling to the bathroom. On some days, I couldn't get out of bed. I couldn't crawl to the bathroom. It took my girlfriend, all of her strength to get me into the car just to go to the emergency room. I mean, literally, I would crawl. And that's when I said, look, I can't live like this. And then I started to do a deep dive into the different surgeons. I started to make different appointments. So it was only a few months before the surgery for me, maybe 3 if I remember correctly.
And then in the post-op surgery, give us a kind of, people, as you know from being in the group, they panic, right? They're panicking at 2 weeks, they're panicking at 6 weeks, they're panicking at 12 weeks, and even so on. And obviously, I think, how far are you out right now?
15 months.
And obviously, we know where you're at today, but where was it where you saw?
I tell you, yesterday I was in the gym. I was deadlifting. I was doing double unders, where you jump and you flip up the rows twice. I was working out with the 30-year-olds, and I had zero back pain. I had some, lung pain because I'm getting old and I was tired. But it was the one thing my knees hurt, but it's like the one thing I don't really have is back pain. Now, that being said, if you weren't deadlifting 300 pounds before the surgery at any time in your life, you're probably not going to go deadlift 300 pounds. You know,
Sure.
I think you can get back to that level, but if your back pain was keeping you from doing things to improve your physical fitness, then once that back pain is gone, I think you can, you have a chance to go back. You know, but my whole thing was not to go back to be an athlete. I had this surgery because the back pain was horrific and I couldn't live a normal life. Does that make sense? What question did you ask me? I know I talk a lot.
Yeah. So, you know, give me the time frame. Give me like your 1 month, because I remember, and we talked about this last night, when you went to the movie theater and you went and watched a movie and you left the movie theater and you didn't think you were going to make it to your car.
Right. So I went to the movie theater that had the reclining seats, figuring that it was okay to recline. It was probably the 2-week mark. In 2 weeks, you know, I'm walking with a walker. You know, I'm moving gingerly, and I've got that pad on that he puts on me, you know, that keeps everything in place. And I got in the movie theater, I sat back and I watched them, and I tried to get comfortable, watch the movie. You know, it's just 2 weeks out. And again, 3-level fusion on the bottom, takes a lot longer to heal, 2 levels of ADR. So I don't know what my results would have been if I just had the ADR. Maybe I'd have been like Robin, you know, horseback riding 6-8 weeks later. But with 3, and I think each level you go, it's harder to recover. It gets harder. So I was in the theater and I tried to get up, and I couldn't get up without the nerve pain. And I started to panic because I also had to pee. And I'm like, oh shit, I'm going to piss down my leg. You know, at the same time, you know, I'm in the movie theater, I'm trying to stand up, and you don't want to ask anybody for help. And you know, like I'm sitting there, you know, do I need to ask for help? But it was, the pain was bad. Yeah, that was part of the recovery. But my whole motto on the recovery was each day, like Dr. Rasuli told me, start walking when you're post-op. Get up, start walking. The nurses will help you start walking. And one of the things he advised, I thought it was great for me, was he wanted to do the surgery in a surgery center instead of Cedars. And I said, that's great, because I don't want to be around a bunch of sick people with infectious diseases. So let's do it in a surgery center. Great. You know, private, you go in, it's just you. You know, you got 3 nurses. You're not, you know, being bustled on that thing with all the people who are sick, you know. 2, he has a group that he recommends as privé aftercare instead of being in the hospital, which is great again, because being in the hospital, you know, I'm around a bunch of sick people, and anybody's been in a hospital, you know, the smell and all that stuff. I try not to go to the hospital whenever I can. So there's like a privé aftercare, which is right by his office, which is upstairs, and it's like the Four Seasons. You know, I remember there were only 2 patients. Another guy had a knee surgery. There were like 8 rooms, and there were 3 nurses. So literally, I'm in this plush bed with the big TV, and right down the hall, I've got 3 nurses. Hi, can you come lift my foot? Oh yeah, everything, you know. So it made it very easy and comfortable. Now I know there's something to be said for, you know, like how quickly people can get out of there. Like, but my advice was I would stay an extra day. I wouldn't put that pressure on your family and the people around you when you have nurses and you're sitting like in the Four Seasons, basically. And the cost is a lot less than staying in the hospital. So if you have that option wherever you get it done, where you can go to private aftercare and it's plush, do it and stay as long as you can. You know, I was like, I came home too soon. I should have stayed a few weeks. It was fun.
That's fantastic. You know,
let me go back to this. My motto on recovery was, we started walking that night, and that was his thing. Start walking. If you can't walk, have the nurses get you up and to walk. And I said, okay, I'm going to take a couple laps around there. The next day, I'm going to add a lap. The next day, I'm going to add a lap. And for me, it was each day extending my reach beyond the previous day's grasp. Just doing a little bit more. If I walked to the corner, I would walk 3 houses more. The next day I would walk 6 houses more. When I got back to the gym, once he gave me the clearance to go light, I didn't start deadlifting 300 pounds. I started with a 5-pound dumbbell in my hand, and I literally stood up like this and slowly, keeping my back straight, went down 6 inches. 6 inches. The next day I grabbed those 5-pound dumbbells and I went down 10 inches. Then I went down to my knee. Once I could get to my knee, I said, okay, those 5-pound dumbbells, I'm going to go to 10-pound dumbbells, or 7.5s. And I gradually kept doing that. And then the next thing, it was like, okay, I'm going to get the bar. the barbell. I'm going to take it off the bench press. I'm going to hold it right here. And I'm going to slowly go down, touch my knees, come back up. Then I would put 5 pounds, 10 pounds, 20 pounds. Once I got to 95 pounds for me, which was adequate weight, I said, okay, I'm going to go down a little bit lower. Then I put boxes on the ground, weightlifting like boxes, and I went down to, went back to the bar only, took all the weight off, increased the range of motion, went down right below my knees, increased the range of motion to the full range of motion for a normal deadlift. Once I had the full range of motion, I added some weight, went back up higher to a shorter range of motion, down to the knee with 95, with 45 pounds, 55, 85, 95. And I kept doing that over and over again over a, 5-6 month period. When I got to about 6-7 months, then I was back to like 225 full range of motion.
When did you know you made the right decision? Because that's one thing people ask themselves. They'll say, I don't know if I made the right decision. When did you know that your back said, okay, this is going to get a lot better?
That's a great question. I know the first couple of weeks when I was getting that nerve pain, I was like, oh my God. I think I reached out to, we conversed on Facebook. The first couple of weeks when that nerve pain was there, I was like, I did not know. It was painful, but not all day. It wasn't like I was just laying like in bed, but there were times when that prodding, and I've talked to, and it seems pretty rare from all the people I've talked to who've had back surgery. It happens once in a while. Yeah, I don't know, again, because mine was a 3-level. Look, I had a major back reconstruction.
Sure.
People who have major back reconstructions don't turn out like this normally, or not in the past. My father sure did not. I would start to say, it's hard to go back and remember those times. And specifically, I would start to say maybe 3 months in, when I could start to lift, but I wasn't really sure until I could, I started like deadlifting and I could go full range of motion and I could lift, 285, 225 pounds. So you're not really sure until you get close to, like what Dr. Rasuli said, back to your normal way of living. If I would have been stuck, I couldn't lift more than 135 pounds on my progression to rehab, then I would have been like, oh, this didn't succeed. My back pain is gone, but I've lost some vitality in life. So it took a while. And still I knock on wood, like, hey, like I told you, something may happen. Maybe this isn't work, maybe this is like a 1.5-year fix, and at year 2, I may flop. But when you've had back pain for a long time, when it's that extreme, I think that's the mentality you keep.
Where along the line, so I don't know if you were pre or post, but medication, let's talk a little bit about that. Were you taking ibuprofen once in a while? Were you taking some painkillers once in a while? And then obviously post-op, what were you taking and where did you remember stopping? Did you take any type of the nerve, a gabapen or Lyric or any of those drugs? Or you just avoided those? And what's your philosophy behind it as well? Right.
So my father was an opioid addict. He died from an overdose of opioids. And he was an addict, and so I had a big fear of the opioids.
Sure.
Right.
Okay.
Yeah. He died young, at like 57 years old. So there was that fear ingrained where I don't want to be an addict. And I also have that mentality, like, I'm a man, I'm tough, I don't need this stuff. But Dr. Rasuli was, if you're in pain, you take it. So for me, it was a balancing act. I will say this though, if you, after the surgery, just start taking your fiber, because there's nothing worse than not being able to shit.
Sure.
And you have a 6-inch scar running up your stomach with a bunch of stitches. Take your fiber, take whatever you have to take to help you go number 2, because that was the second thing for me, sitting in privé, trying to eliminate, and it felt like I was trying to push a basketball through a hole that big. It literally felt like that, Jim. And I was like, and then when you push, the stitches hurt. So someone told me to take the pillow. The nurse told me to take the pillow off my bed, shove it up my butt. No, I'm kidding. She'll take the nurse off the pillow off the bed and push it against my stomach to put some pressure back as I, eliminated. And that fiber didn't. Eventually I had to, and this is, this is a reality for anybody who's taken, the opioids. Eventually the one thing that worked is the one they put up the rear. There's like a little plastic thing, like and all of a sudden,
right.
It's like you're shaking, like, okay, it's happening. It's almost like giving birth. But so that's one of the things that post surgery, if you're someone who knows to get backed up from that, make sure you get on that early. What did you ask me? Oh, the painkillers. So for me, I had this notion in my mind that I was going to, take as little as possible. Right. And for some reason in California, the oxycodone and whatever it's called, Oxycontin, the pharmacy wouldn't even give it to me. They're like, CVS are like, oh yeah, you have to wait a week. So he prescribed something, his office is really quick. They prescribed something differently. I don't remember what it was, but
Norco.
Norco?
Yeah.
I was hoping we get
it was Norco, but it was something else. It was a little tiny pill. It was a little tiny, the first couple of days besides Norco. I mean, I still, put it this way, what he prescribed me 15 months ago, I still have some left of the Norco. But what I found for me worked really well was tramadol, because it didn't cause the gastro effects and it took the edge off. So I wanted to get off as quick as possible, but I had to balance that with being in pain and that not allowing the healing to promote. So Dr. Rasuli, if you're in pain, do you not heal as well?
No, the pain and the healing circuits are usually independent as far as the brain is concerned. You can still heal even if you're in pain. The pain is just a natural response to the surgery. And in some cases, it's a warning sign that something's not going well. But the healing response, which is parallel to the pain response, is independent.
What do you recommend? Like how much pain in the first week or first 2 weeks should someone try to, what threshold? Should they try to brave it out or?
That's really a personal preference. Our recommendation to patients is don't get behind of the pain, so to speak. Take the pain medication liberally so that you're comfortable. The other side effects you can deal with, the constipation being chief among them. You don't take so much that your mental status is altered or other medical issues can occur, but these narcotics are usually spread out 4 to 6 hours, and you should take them, and as long as you're in pain. And the pain doesn't last very long, particularly with disc replacements. It's a very quick recovery compared to fusion.
Dan, how long was it till you got behind the steering wheel? Because that's always a question. When can I go back to driving?
Gosh, I don't even remember. It seemed like it was really, really quick. It was really, really quick. But, again, like Dr. Rasuli just said, I had the fusion and I had a 3-level, and your results are going to most likely be different if you're having a 1-level fusion, a 2-level fusion, a 3-level fusion versus this. But I want to say, was it 2 weeks? Does that sound right, Dr. Rasuli?
Correct. Most people with surgeries a little smaller than yours go back to driving 3 or 4 days afterwards.
Right.
It's really quick, but 2 weeks seems pretty reasonable.
Yeah, I think it was probably within 2 weeks, just when I felt like I could, move. The hardest part was getting in and out of the car. Once that was, how long did I have the stitches in? Do you remember?
Your stitches should have been absorbable. They absorb by about a month.
Oh, I didn't go back and get them pulled out.
No, you didn't have anything pulled out. Must have not
Such
been
an unreliable narrator.
Yeah.
I don't know. I can say this story. Every time I went back in, Dr. Rasuli was really great. And, I don't know if he did this for all of his patients, but I imagine that he does is, he gave me a cell phone number. He says, I'm available to you, 24 hours a day. I never tried him in the middle of the night, but 24 hours a day, call my cell phone, if I don't pick up, leave a message and I'll get back to you. And true to his word, whenever I had an issue, I called his cell phone and, him or his staff got back to me right away. And for me, that gave me, great comfort to know that he would be there. And it was surprising to me because, again, when you first meet Dr. Rasuli, like you can see right now, he's the best dressed guy. He's a little buttoned up. He's not he's not the most talkative guy like I am. But so I was like, okay. But he was very warm. and very helpful after the surgery. He's still not talkative, but he still looks good.
It's hard to talk in the room, I think, Dan. It's hard to get a word in sometimes, but this is what we're looking for. This is what the group is looking for. So it's going to be so well received because this is as good as it gets. This is true and as honest as it gets.
Well, look, when we talked about this yesterday, Jamie, as I cut you off, we talked about this yesterday, and you're saying, hey, thanks for coming on and making time. I said, if we, and by you doing this, can help one person make a better decision for them and have them get an ADR if they're a candidate instead of a fusion, have them get their recovery back much quicker instead of waiting 3-6 months, a year to let that bone fuse, to worry about adjacent disc syndrome and then having to fix levels as they go up. If we can help one person or a handful of people just by doing this, we've done a great service. Each day I try to do one good deed, whether it's opening the door for somebody, whether it's buying coffee for the guy behind me, whether it's expressing gratitude to someone. And I feel like this is the good deed that we can do that's going to pay into the future. Because again, I didn't even know this was possible 2 years ago. I thought I was going to be stuck like my father in a hospital bed in my living room for 6 months and never getting back to the level of athleticism and vitality I had. I mean, I've played tennis, I played pickleball, I jump rope, I've jogged, I've played basketball, not very well. I've done all of these things, and I just didn't think that was going to be a possibility based upon the old science of what my father had 25, 30 years ago.
It's fantastic. Like I said, these are all big indicators that will hit home for a lot of people. Like he says, if we can make a big difference. And full disclosure for myself, I started this group for this very reason, is this way to get back to every day. And I don't get any perks, I don't get any trips. I fly over the world for this group because I passionately believe that there's been a better way. And Dan, you don't know this about me, but I was in spine as a rep for many, many years and saw the travesties of people being fused at a younger age and going back and having revisions and so many different things. And this is why I started it. Like I said, I do it for it. Nobody in this meeting today is being paid for anything. We just want to show people that there is a better way and a better way of life. And there's,
I have to make a disclosure. Dr. Rasuli told me he would give me fashion tips. I did this. Look, he told me to give me fashion tips if I did this.
Listen, I could probably use a few myself, so maybe I can get on that bandwagon. Hey, Dr. Rasuli, I wanted to ask you, as we're getting ready to close here, what is on the horizon for you? Obviously, you're probably going to be the CrossFit spine doctor, going. But
it shouldn't be just the CrossFit spine doctor. Everybody I've sent to him, a couple people I know, I've gone to him, have had great results. Regular, normal people who want to be out of pain, sure, and who want to have function in their life, and who don't want to be limited by their mobility and their back pain. It could be from the 80-year-old grandma to the 19-year-old kid.
I completely agree, and I was kind of going to get to that. One of my moderators was one of the first people that went to Dr. Rasouli, and she speaks highly, and I thought, man, this would be a good person to kind of have in the group that has experience, went through the surgery and can speak, really well. And she's a very young person. She has an Amazon business, so she's doing extremely well. But once again, I completely agree. But Dr. Rasouli, what's on your horizon? Anything you want to mention? I know you're doing some cervical disc revisions when you're taking a fusion to a disc replacement. Is there anything else you'd like to kind of tell the group?
Yeah, we're continuing our sort of march toward moving spine surgery from the hospital to the outpatient center, because our surgeries have become so minimally invasive, minimal blood loss, minimal surgical time, going home the same day. The whole aftercare that Dan had to go to is being used less and less. We've had to use it less and less, and that really goes to the quality of our anesthesiologists and sort of our support staff in the outpatient setting.
Where you said they go home the same day? Some people do?
Same day.
Wow.
Same day. And just like spine surgery is sort of moving to the next level, anesthesia is as well. So what's on the horizon is to continue to develop our push to the outpatient centers for so many reasons. Because I want patients to think of spine surgery really as a quality of life surgery that is not involved, it's not scary, it's not sort of this daunting task that you go into the hospital for weeks upon end and have only a marginal result. So redefining what we do is our goal.
I have two questions for you, and then before we jump, because I know we both have to jump. One is, what's the number one objection people you hear from patients, prospective patients coming in when you mention ADR to them? Is there a common theme, like, oh my God?
No. So patients come in not wanting to be fused. So they think they can't get any surgery. And when you mention artificial disc replacement to them, patients that don't know about artificial disc replacement, they're reassured. And then some patients come in asking for artificial disc replacement. It's becoming more and more a patient-driven thing.
Okay, second question is, I know on the cervical right now, most insurances are covering 2, but on the lumbar, they're covering 1. Where are we? Do you have an idea on the process of getting them to cover 2-level lumbar disc replacements?
It's an unfortunate process and situation. 6 years ago, I believe, I completed or helped complete the review for the FDA IDE study for 2-level pro disc in the lumbar spine, and that really hasn't gone anywhere, unfortunately, largely because of the inertia that I mentioned earlier on amongst both insurers and sort of these so-called reputable surgeons at the academic centers that often inform the insurer's behavior. But we'll get there eventually. The more and more of the public, the lay public that push for disc replacement instead of fusion and other treatments, the more likely, as consumers, the more likely these insurance companies are going to have to respond.
And then how long, I'm going to jump one on this, how long did it take for the cervical to get approved, for this first level, for the second level, from whence they started doing it? Did it take a long time?
It took a long time and a lot of money, but I don't think it was more than 7 years.
But it's just, interesting to me how science is moving, because didn't they used to fuse knees before they replaced knees?
Yes. Yeah.
So you used to get one joint, you used to walk around like with a wooden peg leg, right?
Correct.
And then over time now knee replacement is like, and I think that's going to be the future for ADR.
Yes.
Oh yeah, go get it. Boom, 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 boom.
Exactly. That's the future we want to help sort of promote and build.
Cool.
I wanted to mention there was a girl that was in the group very recently that got approved, and this was in Texas, for a 2-level active L. And it was through Blue Cross Blue Shield. And I was quite surprised. And she was sending me some messages. And I said, by the way, how did you get that approved? She said, yeah, Blue Cross Blue Shield of Texas approved 2-level. So that's the first I've heard of it. And you're looking at me like that's the first you heard of it as well. So, things of...
we get them from time to time. From time to time, we can approve 2 levels. It really depends on the policy.
Those are things I don't know because I don't really ask a lot of times, or and I kind of knew what Dan's situation was. So it was good to see, though. It was definitely positive. And Dan, what's on your horizon in your career besides the great podcast, Calm the Beast? What else do you want to tell our viewers about?
You know what? I think just go out and if you're in pain, get fixed. There's no reason in this day and age that you got to walk around in pain. Most likely, especially if it's back. There's great guys out there across the country. Again, I live in Los Angeles, so I chose Rasuli because he's down the street. Go out and get fixed. Go live your life. It's too short.
Sure, fantastic. Remember, folks, if you're watching this, subscribe. I got a lot of more videos coming out. I'm going to be in Puerto Rico. Dr. Rasouli, you going to Puerto Rico next month for International Society for Spine?
I may go, but many of my team members will be there. We have some data to present regarding our outpatient results.
All right, I'll try to find them. I'll be there for the entire time. So, maybe if you happen to go, we'll come across and we'll do something as well. I'm probably gonna do some real-time videos as well. And
that'd be great
for the group. And I think you see what great turnout it's been for you. And once again, I really appreciate everything you've done for the group and and taking care of all these patients. That's it for me. Remember to subscribe. You guys have a great day. I'm going to start.
Hey, Rasuli, go fix somebody's back. All right. Get off this call.
I'll get busy.
All right. I'll see you guys. Thanks, guys. All right. Bye-bye.
Take care.
Hi, I'm Dr. Alexander Rasuli. I'm a board-certified, fellowship-trained spinal surgeon in Beverly Hills, California. I have the privilege of treating patients who are in pain or are suffering dysfunction from spinal disorders. The vast majority of the patients I see can be treated without surgery. In the few patients in whom I do recommend surgery, there has been tremendous innovation in the last 5 to 10 years. We've come a long way in the last 10 years. Modern spine surgery is all about rapid recovery. There are some incredible innovations that we can offer our patients these days, including our ability to do surgeries faster, to do surgeries with the smallest possible incisions, to do surgeries that preserve motion, and finally to perform these surgeries in the outpatient setting, where patients come in the mornings, have their surgeries done, and leave literally hours later. This was unheard of 5 or 10 years ago.